Ever wondered what shocking stories your gynecologist might be harboring? Welcome to the extraordinary world of gynecology, a profession that plays an essential role in the health and well-being of women worldwide. This medical specialty focuses on the female reproductive system, addressing a variety of issues from menstrual problems to childbirth and even sexually transmitted diseases. But let's not forget that a gynecologist's office is essentially a confessional of sorts. It's a space where intimate secrets are shared, where the most personal and private aspects of a woman's life come to light. And with these revelations often come stories that are surprising, shocking, and yes, even downright disgusting. You see, a gynecologist's work goes beyond routine checkups and delivering babies. The examination room, often seen as a sanctuary of health and healing, can sometimes transform into a theater of the bizarre. And trust me when I say that these doctors have seen it all, the good, the bad, and the absolutely grotesque. Take a moment to consider the stories they could tell, stories of forgotten objects, mysterious ailments, and unexpected surprises. Stories that could make your skin crawl, your stomach churn, and your eyes widen in disbelief. They're the kind of stories that you'd expect to find in a horror movie, but these are all too real. But don't be mistaken, these tales aren't meant to scare or repulse, rather they serve as a testament to the resilience of these medical professionals. They remind us of the lengths they go to, the sights they endure, all in the name of ensuring our health and safety. So, are you ready to pull back the curtain and peer into the unseen horrors of the exam room? Are you prepared to hear the stories that your gynecologist might be harboring? Stories that are often left untold? Take a deep breath, brace yourself for what's coming. Imagine discovering a tampon that had been left in for weeks. Now you're probably cringing at the thought, but it's a tale that's all too real and shockingly common. Picture this, a woman, let's call her Jane, was going about her daily life, completely oblivious to the fact that she had left a tampon in. She started experiencing symptoms of what she thought was a regular flu, fever, chills, body aches, the usual suspects. She shrugged it off, thinking it was just a bug that would pass. But days turned into a week, and the symptoms persisted. Jane had started feeling increasingly unwell. She decided to visit her gynecologist who, after a thorough examination, discovered the forgotten tampon. It had been there for weeks, causing Jane a world of discomfort and potential danger. This is not just an icky story, folks, it's a terrifying reality that highlights the importance of menstrual hygiene. Jane was diagnosed with toxic shock syndrome, or TSS, a life-threatening condition caused by bacterial toxins, often linked with prolonged tampon use. It's rare, but when it happens, it's serious. Jane was lucky. She got help in time and was able to recover, but her story serves as a stark reminder to us all. It's so easy to get caught up in our busy lives and overlook something as simple as menstrual hygiene. But, as Jane's story illustrates, it can have grave consequences. So ladies, please remember, change your tampons regularly, preferably every 4 to 8 hours. And if you're feeling unwell, don't just brush it off. Listen to your body. It's usually trying to tell you something. Regular checkups are also essential to catch any potential issues early on. Menstrual hygiene is not just about comfort, it's about health and safety. It's about taking care of yourself because you matter. A truly horrifying tale, isn't it? But wait, there's more. Next up, a story that will make your skin crawl. Welcome to a tale that's as uncomfortable as a wool sweater in the summer. Picture this. A patient walks into the gynecologist's office complaining of an itch that just won't quit. The doctor, puzzled, delves deeper to identify the root of this relentless itchiness. After a thorough examination, the culprit was revealed. A small colony of pubic lice had set up camp, causing an unbearable itch. Yes, you heard right, pubic lice. These pesky parasites are a stark reminder of the importance of personal hygiene. Washing regularly, changing clothes, and keeping living spaces clean can help prevent these unwanted guests. While this patient's case was indeed uncomfortable, it was easily treatable thanks to the doctor's quick thinking and expertise. And it serves as a potent reminder, never ignore an itch. It might be more than just a passing annoyance. An itchy situation indeed, but the next story might just top that. What about a patient who didn't know she was pregnant until she was about to deliver? Now, there's a tale that might seem more at home in an episode of a reality show than in a gynecologist's office. But truth, as they say, is often stranger than fiction. Picture this. A woman, let's call her Jane, walks into the emergency room complaining of severe abdominal pain. The doctors run a plethora of tests, trying to figure out what's happening. They're looking for everything from appendicitis to kidney stones. But nothing seems to fit. The pain continues to intensify, and then out of the blue the unexpected happens. Jane's water breaks, and suddenly, everyone realizes that she's not just ill, she's in labor. You might be wondering, how on earth could Jane not have known she was pregnant? Well, it's actually more common than you might think. It's a phenomenon known as cryptic pregnancy, where the usual signs of pregnancy are so subtle, they go unnoticed. In Jane's case, she had irregular periods, and she attributed her weight gain to a recent change in her diet. Even the baby's movements were dismissed as gas or indigestion. This story serves as a stark reminder of the importance of paying attention to our bodies. It's easy to dismiss certain signs as trivial or unrelated to our overall health, but our bodies are complex machines, and even the smallest change can be a signal of something bigger. It's always better to be safe than sorry. Jane's story had a happy ending. She gave birth to a healthy baby girl, a surprise delivery that changed her life in ways she could never have anticipated. It just goes to show, you never really know what's going on inside your own body until you take the time to listen and understand. A surprise of a lifetime, but our final story might just be the most shocking of all. Ever heard of a patient with an uninvited guest in her private parts? Well, buckle up, because this story is one for the books. There was a woman who came in complaining about a strange sensation. She described it as a wriggling feeling, something alive inside her. Now, a gynecologist's job is full of surprises, but this was something beyond the norm. The doctor, keeping his professional cool, decided to investigate further. As he performed the examination, he discovered something that not even years of medical school could have prepared him for. There, right before his eyes, was a live worm writhing inside the woman's vagina. A sight that would make even the most seasoned medical practitioner feel a bit queasy. Now, you might be wondering how on earth a worm ended up there. The woman lived in a rural area where sanitation wasn't at its best. She often went without underwear, and this, combined with the unclean environment, had created the perfect opportunity for the worm to make its way into her body. It was a stark reminder of how vital cleanliness is, especially in our most intimate areas. This situation was handled with the utmost care and professionalism. The worm was carefully removed, and the woman was treated for any potential infections. She was also given advice about maintaining hygiene to prevent further uninvited guests. This story is not just about the shock factor, though. It's a testament to the incredible work gynecologists do every day. They're not just there to perform routine checkups or deliver babies. They're there to handle whatever comes their way, no matter how unexpected, or in this case, downright disgusting it might be. So, the next time you cringe at the thought of your annual gyno visit, remember this story. Consider the fact that your gynecologist has probably seen it all, and your routine checkup is a walk in the park for them. A story that's hard to forget, isn't it? It's a reminder that gynecologists deal with more than just routine checkups, and they do it all with a level of professionalism and courage that deserves our utmost respect. Feeling nauseated yet? Well, brace yourself, as we're about to dive into a brief recap. We've explored the unseen horrors of the exam room, the tale of the forgotten tampon, the case of the mysterious itch, the surprise delivery, and the unforgettable story of the uninvited guest. Each of these stories, as disturbing as they may be, serve as stark reminders of the paramount importance of personal hygiene and regular medical checkups. It's easy to dismiss these stories as mere tales of the grotesque, but they underscore the reality that neglecting one's health can lead to severe and often embarrassing consequences. We hope that these tales have not only entertained, but also enlightened you on the importance of maintaining good health habits. So, let these stories serve as cautionary tales and inspire you to always prioritize your health. Remember, these stories are not to scare you, but to remind you to take care of your health. Until next time, stay safe and stay healthy.